This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. This morning, many of us are still trying to absorb the news that at least 19 children and 2 adults were killed in another school shooting, this time in Uvalde, Texas, on Tuesday. Later this week, we'll be talking about this latest mass shooting, nearly 10 years after Sandy Hook, the Texas shooting just 10 days after Buffalo. Now, we can't forget gun violence impacts local residents, too. Guillermo Gonzalez was killed May 10th, when, according to the Hartford Current, he stepped out of his apartment building on Zion Street to grab a hot dog. Gonzalez was the city's 13th homicide victim this year. Officials say he was an unintended target of a drive-by shooting. Who do you want to hear from about gun violence in our state, in our country? You can reach out to us on Facebook and Twitter at Where We Live, or you can email me, lucy@ctpublic.org. Now, our show today is about helping improve the health of residents who live in food deserts. Healthcare officials know food deserts are a huge problem, especially when working with patients who need access to healthy food to help manage medical conditions like diabetes. Coming up Where We Live, we learn about a pilot program through Hartford HealthCare that treats food as medicine. Just this month, the hospital system opened a small grocery store, also known as a food pharmacy, on its property in Hartford. It's called the Healthy Food Resource Center. We're going to learn more, and you can join us, 888-720-9677. That's 888-720-WMPR. You can share a comment again on Facebook and Twitter at Where We Live. Joining us first on the phone is a Connecticut resident. Jessica Soto is a patient at the Hartford HealthCare Food Pharmacy. Jessica, welcome to our show.
Hi, thank you. Good morning.
Can you tell our listeners a little bit about yourself, where you live, and what were some of the health challenges that brought you to this pilot program?
I am 35 years old, and I live in Hartford, just minutes from the hospital. And I got started with the food pharmacy through the Bridge and Infusion Clinic. Due to, I have diabetes, and I suffered a massive heart attack March 15th. So I've had to completely change, my lifestyle and the way I eat, and they referred me to the food pharmacy, and it's been a blessing because I can get so much. They help so much, and everything is things that I can eat for my special diet.
Well, I'm glad to hear that you are doing better since that massive heart attack, Jessica. So you have a cardiologist at Hartford Hospital. Is that how you got a prescription to come to the food pharmacy?
Yes, it is where you have to have a prescription and a referral from your cardiologist. And I see Christine Cosgrove over at the Bridge and Infusion Clinic, as well as Dr. Riaz at the cardiology building on Retreat.
Backing up a little, when you shared with us that you had this heart attack and that you have diabetes, how has this impacted what you do outside the home, your job, your interactions with family?
It's been very hard. I cannot work right now because of the heart attack and the damage to my heart. I have advanced heart failure now. So I've been out of work, which has been, it was hard. I couldn't keep food on the table for my children. As far as my family, I don't have a lot of family support here close to Hartford, so it's kind of just me and my boys.
Mm-hmm. So tell us a little bit about your boys and when you had to stop working, how you've been able to manage, Jessica.
It's been tough. Thank God for food pharmacy. David and Dorelli and just everyone over there. It's been a blessing. It helps a lot. I can go once a week and get, produce, fresh meats, anything. So that's been a huge help. I homeschool my kids, so it's given me a little more time with them to do that now that I'm not working, but it just makes it financially harder in other ways.
Again, you're hearing Jessica Soto, who is a Connecticut resident, and she's a patient at this pilot program that Hartford HealthCare rolled out this summer. It's a so-called food pharmacy, and we're going to hear more about how this is helping Jessica have access to healthy food and changing her diet to help manage her health condition. But I wanted to bring into the conversation David Fichandler, who's Senior Director of Clinical Operations at Hartford HealthCare. Dave, welcome to our show.
Good morning, Lucy, and thank you for having me.
So we were hearing a little bit about how Jessica was referred to the so-called food pharmacy. Again, it's actually called the Healthy Food Resource Center. So where did this idea come from?
Yeah, this is an idea that's been brewing for some time. I think I can trace its roots back to 2019 when we were doing our community needs assessment and understanding, what our patients were experiencing, what our families were experiencing. And as part of that, and digging a little deeper, we discovered that our patients and their families were making choices between coming to medical appointments and feeding their family, and in some cases getting medications or feeding their family. And so we were seeing cancellations of appointments, the health of our patients not getting better as we would have expected, and it was likely tied to their nutritional health. And so that ties in, pretty closely with what we were seeing in the data, which shows that as much as 30% of the Hartford County is nutritionally or food insecure. And so that is kind of how the concept was born.
At the top, I described this food pharmacy kind of like a small grocery store, but can you describe it for us, Dave?
Sure, absolutely. So it is a market. But what makes it different from a food pantry or other food sources that are given out to patients and families is that there's a high focus on nutrition. There's a predominant amount of fruits and vegetables, even the carbohydrates, the beans, the pastas are whole wheat. We use olive oils. The proteins are all lean, proteins of chicken and beef and pork and seafood, et cetera, that allow folks to make healthy choices in partnership with the clinical teams. And I think that's one of the most important differentiators that Jessica described, is that the partnership with the clinical teams is what helps to make this a success. It's not just the distribution of the food.
Right. Jessica Soto is still with us. So Jessica, walk us through when you walk into the food pharmacy. Again, this is on the grounds of Hartford HealthCare. Who's guiding you? How are you shopping for food for you and your two boys?
Well, when you walk in, you're greeted by Dave and his wonderful team. And they point you in the right direction. Not only do they point you in the right direction, if they see that you didn't grab something, they'll say, well, have you ever tried to eat, Brussels sprouts? And no, I haven't, Dave. And they will, you should try them and you can make them this way. And they not just point you in the right, they give you recipes. They're a huge help. Because many people who are walking in there probably have not lived the healthiest lifestyle. Let's be honest. So I surely did not. This is new for me. So to have someone like Dave and Jarelli and whatever other volunteer happens to be there that day, to have them actually giving me recipe ideas, and it actually is helping encourage me to try new things, and not just for myself, for my children, because now I have to think about them, and so it's a huge help. They help you a lot. So they greet you, and you just grab, they provide the bags for you, the reusable bags, and you just go through and grab. They have, like Dave said, fresh produce and vegetables, lean meats and seafood. The pastas are whole wheat, the flour is whole wheat, the rice is whole wheat, but my boys and I are loving it so far. We don't see a difference in taste or anything.
Well, that's good to hear. So tell us, before you started going to the food pharmacy, where were you able to access food? What were you buying, and how this has changed again? Maybe some of the food that you're cooking at home, Jessica.
I receive food stamps So I would have some help from the state. I was doing groceries, but I will admit I was not shopping the healthiest. I wasn't buying whole wheat anything. As not even the oil. I wasn't buying the olive oil. So that's how I was grocery shopping before. I think a lot of people say it's expensive to eat healthy, and it's sad because it's cheaper for the junk food and all the carb-filled stuff. But if you want to live a healthy lifestyle and, with my condition, I have to make this change. I also find that with the whole wheat, it's filling and for a longer period of time. I don't know if it's just me, but I find a lot of the food that we were eating were just empty carbs, and we were just, an hour later looking for something else to munch on. And now that we're eating a little healthier and the boys and I are having fruits in between meals, we're staying full longer and we're not eating as big of a portion.
David, I wanted you to pick up on what Jessica said, that, eating healthy can be expensive. And so when we think about who's eligible for the food pharmacy, and, how long does it last where a patient like Jessica can access the food for free?
Yeah, that's an important point. So we are working to develop healthy habits, but it is a partnership, right? So we can't grow and sustain and build the program continuing to feed, knowing what the demand is for perpetuity. So we work with folks like Jessica and other families, and over time, over the next 3 or 6 months, we will work to connect them in with resources that will allow them to continue to be able to shop healthy and shop healthy in the community. So we're partnering with other groups like Food Share, My Local Chefs. Vanessa Sina has been hugely helpful. Seatown here in Hartford, our own Hartford HealthCare Food Nutrition Services, to be able to help educate, give resources, and get access to food, not just in one market on the Hartford Hospital campus, but across the city and the region.
When you think about the footprint that Hartford Hospital has, of the neighborhoods, the people that are living far below the poverty line, and how difficult it is to make food choices when they've got other bills they have to pay, and there isn't an easy way to get to places that may have more of a variety of healthy options, Dave.
Yeah, and that's our goal, right? So we can't fix everything right away, right? We're taking this pilot program to try and establish the model, and then hope that this becomes something that could be far more sustainable, far more broad than one hospital, one location, because the demand is pretty significant in the city of Hartford and beyond.
And you have a collaboration with Food Share. Can you tell us more about how you're stocking the food pharmacy?
Yeah, so it has been an absolute blessing to have the collaborative efforts of Food Share, Seatown Markets here in Hartford, the My Local Chef team with Vanessa, just to be able to provide us with fresh access to food, but also culturally sensitive food, knowing the populations that we service and that have a demand in the immediate pilot phase. And so we couldn't do it on our own. And so the capacity to have access to have food delivered to us, have it be, the fresh produce beyond it being seasonally appropriate, just the access to the fresh, not just canned foods and bags of carbohydrates, but really the fresh produce and the fresh meats with local farmers from, in the Connecticut, in the Hartford region has really, really been a godsend, and what's allowed us to help people like Jessica.
Jessica, you're still with us. Dave said that it's important to have food that is culturally sensitive. So talk through with that. How do you respond when you think about maybe some traditional foods that you like to make, that your boys like to eat, and the fact that do you have to give that up completely? I mean, how are you walking that line?
We're doing okay because they actually are very culture friendly with some of the things that they have. My huge thing is I love sweet plantains, and every time I've gone, since I started 2 weeks ago, they have the sweet plantains, and They, have the olive oil instead of, because those are fried. Instead of frying them in regular oil, I now fry them in minimal olive oil, and that's something that I can still have, once in a while. And they have that. They have a lot of the. I don't eat a lot of them. I would love to, but I wouldn't even know where to start and how to cook them. I'm Hispanic, and a lot of our culture, like a lot of things like yame and things like that, and they have those there. Their produce variety is amazing. They had papayas when I went on Monday. I've never had it, but I'm going to try it. And like Dave said, they have, fresh stuff from the farm. They have fresh eggs from the farm, milk. They have such a huge variety that it hasn't been too hard for us to make the switch to healthier things because of the big variety that they have.
Have you had to change up
the help with? I'm sorry,
Jessica. Have you had to change up maybe the seasoning that you once used?
Yes, absolutely. One thing I tell everybody about that I did not know, adobo. As a Spanish household, everyone has adobo in their cupboards. But it is so high in sodium, and I did not know that. I don't use any salt or any salt seasonings. I use, instead of garlic salt, it's garlic powder, onion powder. And I did stop making the adobo. But I was told by my cardiologist there is actually a recipe to make a sodium-free adobo. So I'm looking forward to that. But I just wanted to mention that because a lot of people did not know that adobo was actually very high in sodium and the worst for you. So that's just one of the things, like not being able to cook with adobo sazon. But I find that with adding in all the onion powders and the garlic powders, as I mentioned, and as well as I make my own homemade sofrito, which is, pureed onions and peppers and garlic. It gives the food plenty of flavor. You can't even tell that it has no salt in it.
So I've got to ask, Jessica, how are you doing now? I know you're a new patient to food pharmacy, but are you seeing the changes when you go to the doctor based on this new diet?
I have. I actually went to the doctor just the other day, and I am down 6 pounds.
Excellent.
This week alone. So I'm doing good because I was retaining a lot of water as well. But with the diet, it's helping. I am down, like I said, 6 pounds. I feel like I have more energy. My heart is getting, it's going to be a long road, but it's getting better.
And your blood sugars?
And my sugars are getting better.
Well, that's great to hear, Jessica. David, how do you respond when you hear, Jessica talking about, these changes and that, she's seeing, improvements that are going to help her health in the long run?
I'm thrilled. I mean, this is exactly why we do what we do, to know that we can help people like Jessica and her family and her boys, as well as the other 250 or so folks that are starting in this pilot program. But it also makes me, pardon the pun, it makes me hungry to want to do more, because we know that no matter how many people we help, there's still a greater need. So I'm excited. I'm thrilled for Jessica. And it's just so validating for the work that we do, but it also makes me want to get more people access as soon as possible.
Right. And this is a pilot program just started this month. I had mentioned at the top of the show, this is for people with particular health conditions like diabetes or cardiac conditions. But I understand that this is also open to women prenatally. So tell us about that.
Yeah, so we went and targeted 3 specific populations: the cardiac congestive heart failure group, as Jessica mentioned, the bariatric, those folks who are either morbidly obese and working through their dietary evolution, or who are in a surgical component from within the city of Hartford, and the prenatal, the Women's Ambulatory Health Service, which is our pre-pregnancy group. And the intention there is really to look at, if we can help moms before the babies are born, help themselves and their families be healthier, we can then help to improve the health of the entire family longitudinally over time. So we know that gestational diabetes is an issue in our patients and in this area. And we want to make sure that we can tackle as much of the health concerns for the mom, the unborn baby, and the entire family, and set them up for the mom, the baby, the rest of the family to be successful in their health journey for a long time.
Anything like this in our state, or is this fairly unique, Dave?
From my research, I think this is somewhat unique in the sense of tying the health component and the nutritional component, the clinical component, to providing access to healthy food. There's a significant access to food pantries and food across the state, but I haven't seen anything that ties the clinical and the educational component that I've come across yet. I would love, if there is, I'd love to partner with them, but to my knowledge, this is somewhat novel.
And when we think about this being a pilot and hoping to expand, does that mean to primary care, reaching even more people, Dave? I think that would also require a lot more money. How are you making this possible?
Yeah, so we actually have dreams and aspirations of expanding to we know the demand is a minimum of 2,500 families. And we also know that we have colleagues in our workforce who are City of Hartford residents who, in our research and evolution of this initial assessment, we found that upwards of 8 to 10% of our colleagues here at the hospital potentially are food insecure and are making choices that we need to go after. So, we know that this program, while it's in its pilot phase, will expand fairly significantly. And we've had such, great partners, both in the business community as well as in the donors and others here at the hospital who have helped to make this a success and helped us with fundraising. We've been able to raise, upwards of several $100,000 at this point to help support the operations, the staffing, the purchase of equipment, et cetera. And we have visions of continuing to move that along. I also would be remiss if I didn't say that, the hospital and the health system have made a significant investment from the money of the operations of the hospital themselves to make this a success and sustainable.
You're hearing David Fichandler here on Where We Live, Senior Director of Clinical Operations at Hartford HealthCare, as we continue to learn about the food pharmacy and talk about food insecurity, also local efforts to help Connecticut residents beyond this pilot. He's going to stay with us, but I want to thank Jessica Soto for coming on the show. Again, she lives in Connecticut. She's a patient at the Hartford HealthCare food pharmacy. Jessica, such a pleasure to talk with you. We're glad that you're doing better. Thanks for coming on.
Thank you so much. No, it was my pleasure. Thank you for having me on.
You're listening to Where We Live on Connecticut Public Radio. We'll be back after a short break. You can join us, 888-720-9677. That's 888-720-WMPR. Or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Food insecurity is a common problem. It affects 1 in 8 adults in America. That's according to Geisinger, a health and wellness organization. It came up with the food pharmacy idea, now being piloted at Hartford HealthCare. Connecticut Public's health reporter Nicole Leonard reported recently that food insecurity refers not only to the quantity of food, but quality. It occurs when a person lacks access to enough affordable, nutritious options. And according to a 2019 report by Feeding America, an estimated 12% of Connecticut's total population, or about 428,000 people, are food insecure. Leonard reports the rate of food insecurity is even higher among Connecticut children, at 15%. We're talking about this today with my guest on Zoom, David Fichandler, Senior Director of Clinical Operations at Hartford HealthCare. And so, David, you had mentioned food insecurity, obviously one of the aims to help address this. And so can you talk more about that issue in our state and how this program addresses that?
Yeah, food insecurity and nutritional insecurity is a driving factor in healthcare. And I know that seems like that may or may not be immediately connected. But we know that lack of access to food and people who make choices between food and paying utilities, paying car bills, getting access to medical care, paying for medications. We know that that's happening upwards of 67% of the time in patients who are below the poverty level. And so what we're trying to do is work on creating healthier solutions by providing access to that. It's not an easy solution. It's not a quick solution. But taking one step at a time helps us to move forward.
And we think about, all the people, at the table, so to speak, to help address this problem. The hospital system can only do so much, and policymakers also need to stand up when we think about food deserts and the access to, grocery stores. How do you bring them into the community, David? Is that also part of the plan to reach out to lawmakers when we think about efforts to strengthen this?
Absolutely. When we think about health, it's not just food. It's longitudinal. It affects so many aspects of living in Connecticut, regardless of where you live and how you live. So I think we're at a point where we're piloting this program at this point with the expectation that we'll have enough meaningful information, data, and outcomes from patients and their entire families to show that this program is effective at improving not only the health outcomes, but the medical costs involved in care and the overall health of the residents of the state, which creates a pretty compelling case for our lawmakers to consider.
I mentioned 12%, an estimated 12% of Connecticut's total population are food insecure. So panning out to get another perspective on this issue, joining us now on Zoom is Aldar Devin Avasahalom-Smith. He represents Ward 20 in New Haven. That's the Newhallville neighborhood. Aldar Devin, welcome to our show.
Good morning. Thank you, Lucy. Glad to be here.
And so when we talk about food deserts, again, you're representing a neighborhood among the New Haven Aldar. And so I'm wondering if you can talk about, this issue in your neighborhood and how you're seeing efforts to connect residents with healthy food.
Absolutely. So Newhallville and Ward 20 is essentially a food desert. I mean, the local grocery stores are about a mile away each way. But we mostly have corner stores and bodegas that don't really provide a lot of healthy options. And to speak to just a little bit of the data, the low income rate here in Newhallville is about 67%, which is 1.4 times that of the city and 3 times that of the state. As far as obesity, we rank at 36% compared to 29% in Connecticut. And the numbers with diabetes are also disproportionate to that when we're looking at the state. So access to healthy foods is a real challenge in my neighborhood.
You mentioned the corner stores. So has there been outreach to maybe get them to carry healthier foods? What are the barriers there, Aldar Devin?
There has been outreach, and some stores are amenable to that. But what we run into is kind of twofold, where corner stores have trouble finding affordable produce for themselves to purchase, and where residents are not exactly comfortable with the conditions of the stores all the time to purchase the food. But that is why we are looking for and have found some solutions in our community gardens. We're working very diligently to unify the community gardens we have in our neighborhood, systematize growing, harvesting, and food distribution to the community.
So tell us more about that, these community food growing programs.
Absolutely. So most of our community gardens are leased on city-owned plots by an organization called Gather New Haven. And they really provide the autonomy to community members to decide what happens on that land. So I have been very involved for the past 4 years with community members and others to make sure that the community has access to the gardens, culturally appropriate foods are being grown. And as I said, we're working on systematizing the actual distribution so that it's equitable and making it available to folks in a way that they can see food demonstrations and feel really a part of the process.
You also mentioned it's important to grow culturally appropriate foods. That's really important because when people are dealing with health issues and they're being told, we can help you access healthy food, but you don't want to drastically change their diet because it may not be a long-term outcome. And so can you talk more about that, Aldar Devin?
Definitely. In Newhallville, many residents and families have migrated from the South, perhaps their grandparents' generation, older generation. So we have a lot of staple items that we grow, such as collard greens, mustard greens, squash, things that are familiar and often deemed soul food, so that folks feel comfortable with what we're growing and what they can get, knowing it's close to home.
Right. And when we think about the options, to purchase food, what are the closest options? You said that there's a mile away, and that's why there's only the corner stores that are able to be in walking distance, Aldar Devin?
Correct. We have from where we are, pretty much, we have a Stop and Shop that's about a mile away and on Whaley Avenue in another neighborhood, and then a Save-A-Lot in Hamden, actually, which is about a mile away. So for folks with transportation hurdles, it makes it a challenge, especially if you're shopping for multiple families. But that is exactly why we're really proud to have the community garden system and also local food distributions through our churches, where in partnership with the Connecticut Food Bank, where we're able to provide produce. I want to mention briefly as well, community leaders are very passionate about this topic, and we have community leaders having children ages 6 to 12 educating other children about the social determinants of health and healthy eating. We also have a local farmer who is working on small-scale agricultural entrepreneurship. So we're really firing on all cylinders when it comes to looking out for the health, wellness, and access to healthy foods of our community.
So what happens in the winter? This is the perfect time to talk about growing healthy food and sharing it. But when you're not able to have the warm temperatures and the space to grow, what happens then, Aldar Devin?
The winters are a real challenge. And what we mostly find is a lot of the community helping one another, whether it's folks cooking meals and providing them to their neighbors, or really relying heavily on our churches, who provide a great amount of support, where they still do their food distributions, which has healthy produce. And but it is a challenge, definitely.
And when we think about, you mentioned data at the earlier, when we look at these community food growing programs, and are you seeing healthier outcomes for the residents who are taking part, Aldar Devin?
I know that folks explain that they feel healthier after having eaten this fresh produce. But I would encourage the city of New Haven to pay really close attention to that, and to perhaps come and help us track some of those statistics and gather some of that data. I think it would be extremely beneficial, even as we move forward, to try to obtain more funding and support for the efforts we have here in Newhallville, especially in Ward 20.
We were learning about the food pharmacy pilot program through Hartford HealthCare. I'm wondering if you could respond, Aldar Devin, to this idea, maybe down in the New Haven area.
I think it's tremendous. And as a matter of fact, in 2012, the Fairhaven Community Health Center partnered with a nonprofit called City Seed to do something called FVRX, which was essentially prescriptions for folks to go to City Seed and obtain fresh produce. But I would love to see this occur, if it's not still occurring in New Haven. I'd love to see it occur large scale in New Haven, or with some of our major hospitals like Yale New Haven. I think that it would be tremendous, just hearing the story of the resident who was on, Jessica. I'd love to hear testimonial like that from folks in my neighborhood as well.
Well, thank you so much for coming on to tell us about some of these local efforts to help food insecure residents. Again, that's Aldar Devin Avasahalom-Smith, who represents Ward 20 in New Haven. That's the Newhallville neighborhood. Aldar Devin, thank you for your time today.
Thank you.
I wanted to just go quickly back to David Fichandler, who's still with us, Senior Director of Clinical Operations at Hartford HealthCare. We had a listener call in. She left her phone number. She wants to volunteer at the food pharmacy, David.
That's wonderful. We'd love to have access to her.
All right.
So pass it along, and I would love to connect with them.
All right. Well, we'll be sure to do that. And we thank you for coming on to tell us about this pilot again. Just starting this month, we'd love to check in and see how it's going, and if the plans to expand when that time comes. We'd love to have you back on, David.
That sounds fabulous. Looking forward to it.
That's David Fichandler again with Hartford HealthCare. You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up after break, we're going to hear from a statewide anti-hunger organization about a new venture to help food pantries who provide for their communities. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We've been talking about food insecurity in our state, and we know local food pantries fill an important role in local communities, but there hasn't been a coordinated approach to help them and soup kitchens purchase food. End Hunger CT has created a new initiative to address this. Joining us now on Zoom is Patrick Dowling, Resource Director with End Hunger Connecticut. Patrick, welcome to our show.
Good morning, Lucy. Thank you very much for having me. This has been a very interesting conversation this morning. I'm glad to be a part of it.
Oh, thank you. So I mentioned food pantries and soup kitchens. Let's talk about their role in local communities. And, when we think about how to help them with a more coordinated approach, when did End Hunger Connecticut think about this new initiative for them?
Well, it all began for us during the height of the pandemic, the early stages of the pandemic, really. We were involved in the conversations with the Department of Agriculture, the State Department of Agriculture, and Commissioner Brian Hurlburt and his team, and other nonprofit organizations in trying to coordinate the food distribution that was happening throughout the country to get food to people when so many people were out of work and food insecurity really increased dramatically in our state. And I was invited to participate in these conversations, and it became very evident to us that that beyond the great, amazing work that the Connecticut Food Share and the food banks do in the state to supply food pantries and soup kitchens and senior outreach programs, beyond them, there was no coordinated organization to help support food pantries' needs to completely serve the needs to feed their communities. The food banks do amazing work, but in some cases, pantries need more than what the food pantries and what donations provide. And we thought that it would be beneficial to create a program, an initiative that would help pantries on a statewide level and to collectivize their purchasing power and their efforts and their talents and share that statewide.
And so this is called the Full Shelves Initiative. How does it work?
Well, one of the first things that we had to do, Lucy, when we started this was to establish where all these pantries were. I say that the pantry system or throughout the country, not just in Connecticut, was begun 40, 50 years ago on a short-term thought process. They thought that, well, we're just going to do this for a little while. We're going to feed everybody who needs to be fed, and that'll be it. And it was, it grew and grew and grew, and it's not going away. There is always going to be a need to support the food insecurity needs of people all over the country. And in Connecticut, this system grew, and these pantries and these soup kitchens, what I call food assistance agencies, were popping up throughout the state. I estimate that there's 800 to 1,000 maybe that exist out there, from larger entities to smaller little church-based situations in basements. So we had to find them all. So we endeavored to do that, and we've identified somewhere in the neighborhood of 650 in the state so far. So to answer your question, the idea is to reach out to all of them, find out what their needs are beyond what the food bank system and donation system is able to provide for them, and help them to procure food when they need more to feed their communities beyond what donations and the food banks can provide, connecting them with wholesale suppliers so that they get the best possible pricing. It seems to us that these pantries are independent little organizations that don't have any power, any purchasing power. But if we collectivize that purchasing power, we can get them better possible pricing and higher quality food and consistent quality food and deliveries to their door when they can meet the thresholds for purchasing.
You're hearing Patrick Dowling here on Where We Live, Resource Director again for End Hunger Connecticut, as we learn about this new initiative to help food pantries. Patrick mentioned, more than 650 in our state, food pantries and soup kitchens, to purchase food more effectively, to share surplus inventory, and connecting them to suppliers and services. The thread throughout our show, Patrick, has been the importance of having access to nutritional food. And so when we think about the food that's often donated, or how food pantries and soup kitchens are getting particular items, can you talk about that? Are these the items that are healthy for families who not only are food insecure, but thinking about the nutritional aspect too? Well,
coming into this, I learned a lot. I learned a great deal about, I've been in the food industry my whole life. I worked for a restaurant group for many years and was a consultant. And still knowing the food industry as much as I did, I still didn't fully understand the pantry system. And it's been quite an education for me. Pantries get a wonderful support, as I say, from the food banks. And through donations. And the reason I bring all this up is to say that donations aren't just from, folks in your neighborhood, but donations can also come from the food that comes from the grocery stores. There's a huge amount of food that is donated to food pantries and food assistance agencies throughout the state from local grocers and grocery stores. And that is a wonderful resource, but in some cases they need other support. So we try to connect them with wholesalers that are going to give them the highest quality product and the healthiest product. But I'm here to help the pantries get what they need, and then it's the pantries. The pantries are the ones that interact with the families and encourage them directly to eat as healthy as possible. We try to be a reliable resource for healthy products whenever possible.
End Hunger Connecticut, I understand, also manages the SNAP outreach hotline for the state, and then I think there's also managing the farmers market program. And so can you talk more about that? Other options too to connect residents with healthy food.
Thank you so much for asking, Lucy. Yes, I'm so proud of what we do at End Hunger Connecticut, and the Full Shelves Initiative. While it's my thing and what I'm focused mostly on, we do great things. We run the SNAP hotline and assist people throughout the state to access their SNAP benefits. And I do want to say that the SNAP call number for anybody who's listening who think they might be able or might need support or would like to find out more about benefits, the number is 866-974-7627. So we help thousands of people every year. We helped over 3,500 individual cases last year, and enrolled almost 2,000 people into the program last year. So the SNAP call center is very, very helpful to getting people to that food resource when they're food insecure and when they need that help. We also manage the summer meals programs information. So during the summer, there are sites throughout the state where families who rely on school food, school meals, when school is out, there are locations all over the state to provide food for any school-aged child. And there is a map on our site. If you go to summermeals.org, Connecticutsummermeals.org, summermeals.org. There's a map that will be updated in June to list all of the places where children, open sites where children can get food. And then the other thing you mentioned was the SNAP doubling benefits. There are 25 farmers markets throughout the state, Bridgeport, Danbury, Ellington, Hartford, Manchester, Middletown, New Britain, New Haven, Wethersfield, and Willimantic, where there are farmers markets where families who have SNAP benefits, when they go to those markets, those participating markets, when they swipe their card, say for a $10 purchase, they will get $20 worth of tokens or coupons to spend. So their SNAP benefits are doubled when they go to these participating farmers markets. So that it encourages families with SNAP benefits to eat healthier and to get healthier foods at the farmers markets.
Well, it's good to hear all those options are available, especially as school is ending, thinking about nutritious meals for the whole family. Thank you so much, Patrick Dowling, again, for coming on to talk about this new initiative to help food pantries and soup kitchens, the Full Shelves Initiative. Patrick is the resource director for End Hunger Connecticut. That's a nonprofit, so if listeners want to help, they can also support your organization, Patrick.
Oh, can I actually say that we're in the middle of a capital fundraising campaign right now, and until June 8th, any donations that come in to help support our organization will be matched 1-to-1 through the Hartford Foundation for Public Giving, who has generously offered us a $20,000 match on fundraising. So I thank you very much, Lucy, for mentioning that. I would encourage anybody who's in a position to contribute to us so that we could help these pantries throughout the state. And I will say, Lucy, I'm going to be calling David Fichandler after this because I want to see if there's a way that we can work together to help his community as well.
That's good. That's good to hear. Patrick, thank you for your time today on the show.
Thank you, Lucy.
I'm Lucy Nalpathanchel. Today's show produced by Sujatha Srinivasan. Our technical director is Kat Pastor. Again, later this week, we'll be talking about this latest mass shooting, the gun violence that's happening in communities across our country, including in our state. We want to hear from you. Again, you can reach out to us on social media at Where We Live, and you can email me, Lucy at ctpublic.org. Back tomorrow.